Hello everyone, welcome to my class. If this is your first time of hearing my voice, you're highly welcome. Today's topic will be on which antipyretic, which analgesic drug is safest for you to give to your baby. So we'll be comparing two types of analgesic. We'll be comparing paracetamol and we'll be comparing ibuprofen. So is ibuprofen safe for children to treat an unconfirmed cause of fever in children? Once our children or our baby is running fever, we are advised to, the first thing is to give water, give sponge bath, try to make the baby to rest, and if the fever persists, then you can administer either paracetamol or ibuprofen syrup. But is ibuprofen syrup actually safe? Is it the first thing we should give? Find out on this video. So let's talk about it. Well, according to research, NSAID, which is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, aspirin. Of course, aspirin should never ever be used in children, but we see a lot of antipyretic and analgesic syrup like ibuprofen. Ibuprofen relatively is actually safe for babies or children to use, but is it the first line of drug that we should use? That's the question of this little video. So let's talk about this. So NSAID without antibiotic, according to research, for acute viral infection increases the risk of a child coming down with something called epithema, according to Moray in 2016. And this shows that ibuprofen as a first line of acute viral infection without antibiotic can actually predispose the baby to coming down with this condition called epithema. So it is advised not to give ibuprofen to children that are below 6 months. The best antipyretic drug to give to children that are below 6 months is actually paracetamol. But for children below the age of 15 but above the age of 6 months, they can actually use ibuprofen. But should that be the first line of treatment? No, it shouldn't, because you do not know the cause of fever. It could be viral, it could be bacterial. So if it is viral, you may shy away from giving NSAIDs like aspirin because it can predispose to the baby to something we call Reyes syndrome. So I was wondering, since aspirin can cause Reyes syndrome, what of other NSAIDs? Can they also predispose the baby to other form of condition? Has enough research been done to ascertain if all these other analgesics, all these other NSAIDs are safer than paracetamol? And in my course of doing the research, that was when I found out that giving children ibuprofen without antibiotic can actually predispose a child to a condition called epithema. So the best and safest drug to give to a child is actually paracetamol syrup. But you don't even know whether it is an acute viral infection. At home, you don't have the knowledge, the skills, the equipment to determine whether the child is having bacterial or viral, and whether the viral infection is also acute. It shows that when given in acute viral infection, increases the risk of the child coming down with a condition called epithema, which is a very, very, very dangerous condition. It is high risk. The child should be rushed to the hospital immediately, according to WHO. But you don't have the knowledge, the skills, and equipment to know whether the child is having viral. So should ibuprofen or any other NSAID be given as over-the-counter drug for children? So the result is, do not give ibuprofen as first line for acute viral infection without antibiotic. And antibiotic is not something that should be prescribed, that shouldn't be given as over-the-counter. It's actually an ethical drug. So my advice to parents, to caregivers, is give only paracetamol, and if the fever persists, take the child to the hospital. Do not administer ibuprofen. Let the healthcare professional evaluate the baby, determine whether the baby has viral or bacterial infection, and then before placing the child on ibuprofen. So thank you and have a wonderful day. Bye.